It really depends on the individual what we recommend. But for example, for a lot of students we recommend that they connect with a counselor here so that they can have someone that follows them and who can answer their questions and help explain the diagnosis and help them find resources on campus. That would be covered by Gold Insurance. Occasionally we run groups here, group therapy. Some students like to participate in that to learn additional skills or relate to other people who are in the same situation. That would be covered by Gold Insurance. One last major one is medication. So a lot of students are seeking stimulant medication being something like Adderall, Ritalin, that kind of thing. And we have psychiatric providers here who can provide that as well. For me, alternative might include skills that are particular to therapy. So for example, mindfulness is a skill that's been shown to have efficacy with ADHD. It teaches people how to relate to their internal experiences differently. And so for someone with ADHD, it wouldn't necessarily make them, help them to pay attention better, but to be more aware of what their patterns are, so that they can plan and work around those. Another alternative resource you might see is things like yoga and acupuncture, which have both have some efficacy with ADHD. A lot of times we'll refer students to some reading outside of here. We'll refer students to disability services where they can receive accommodations with their classroom. I often recommend that people seek out information, published information such as books on ADHD. One great book is called Driven to Distraction. And Driven to Distraction's a great kind of intro book to ADHD. It talks about it in a positive light, talks about strengths of ADHD actually, and it talks about some things to do about ADHD. Another great resource for ADHD outside of here are advocacy organizations. So what you could do there is meet other people that have ADHD. You could learn politically what's going on in terms of ADHD legislation. You could learn about other treatment modalities, what other people are doing to get help.